Hi, welcome back. So now we move on to the standard color vision test. So for the past video recordings, it's all about the sciences behind this color vision defect. Okay, how the color is actually being processed. Okay, how a color vision system is actually formed, and also we look at the properties of colors, how we interpret colors, how we perceive the colors, and then what are the abnormalities that can be actually detected in human being that is related to color vision perception. Okay, so you already have knowledge on that. So now we move on to the crucial part when it comes to color vision topic is how do we do the assessment? Okay, so patient may come in with complaint. Some patient can come in without any complaint. Okay, so how do we do the test for this patient, and also how do we actually pick the correct instrument to perform this color vision test for the patient? And when it comes to this color vision test, they are divided into two categories. Okay, one is the booklet type, where it comes in the form of book. Another one is more into the palette type, or we call it as diagnostic tool. Okay, so we're going to look at these two, color vision test, and I'm going to go in detail on how we actually perform this test. Okay, what are the precautions that you have to take, how to interpret the result. Okay, in terms of interpretation and all that, I will touch lesser, because you will have a better understanding when you are able to do it hands-on. And as you know that we're going to have the lab session, so the interpretation will be explained in detail during the lab session. Okay, so we're going to look at one by one what are the color vision tests that is available. So in this video, I'll be covering on the booklet color vision test. Okay, so the next video recording is going to be the diagnostic one. Okay. And the first foremost would definitely be the Ishihara plates, the universal color vision test. And I'm very sure that all of you have in your practice. Okay, so this is the simplest but beneficial and important color vision screening tool that anyone can have in their practice. Okay, so we go in detail because I'm sure every one of you have it, but I'm going to explain in detail what are the things that you have to know about color vision, Ishihara color plates. Okay. So they are available in 3. Okay, I'm sure your supplier have explained to you before you bought this. So they are available in 38 plates, 24 plates, and 14 plates. Okay, and it is a quick and accurate. It is quick and accurate assessment of color vision deficiency of congenital origin. Okay, so those who are having congenital color vision defect, okay, it's easier to actually assess through this one particular color vision test. You don't need to have a complicated one. This is enough already. That's why most of the practice usually they have this Ishihara plates. Okay, and since they are available in 3 form, 38, 28, 24, and 14 plates, which one is better? Obviously that question would come, but doesn't matter whichever that you have. It is just like, if let's say 38 plates means more plates is available and more answers need to be given by the patient. Okay, 14 means is lesser, but doesn't mean that diagnosis will vary between the plates. Okay, no. So they all will give you the same answer or same diagnosis only. Okay. So there is nothing that one is superior than the other one. Okay, now we move on to the procedure. Okay, how do we perform the Ishihara plate test? Okay, it has to be, in the form of daylight, or the light source should be good enough, and it has to be as far as possible. You cannot use a table lamp, facing the plates. Okay, it has to be either on the ceiling or away from the chart, or facing the patient's face, or facing the plates. It should be further away. Next is the testing distance. This is the mistake that people usually do in practice. Okay, they keep it at 40 centimeter. Okay, but when it comes to Ishihara plates, the original testing distance that is recommended by the Ishihara creator was to hold it at 75 centimeter away from the patient. So it's usually like about arm length. Okay, so it has to be held at 75 centimeter and tilted so that the plane of the paper is at right angle. So it cannot be like this, it cannot be like this. So it has to be like how you read your books. Answer should be given without more than 3 seconds delay. Okay, if let's say you're showing the plate, since it has to be 75 centimeter away from the patient, obviously you are the one who's going to hold the book. So you just time yourself that, ask patient to read. If let's say they don't have any color vision problem, they should give immediately should answer you. If let's say it got delayed by 3 seconds, that means the patient is actually struggling to give the answer. So you can straight away flip to the next page. Okay. And most of us, how do we do the recording? Usually we just record 14 over 14, 24 over 24, 38 over 38, whichever plate that you have. But there is an actual way of recording, which we don't need to actually do this in practice. Okay, usually if let's say a person want to conduct a research, then they can use the recording form. So this is how the recording form looks like. Okay, 14 plates, 24 plates, and also 38 plates. So these are the way of actually recording the answers. So since they have like 14 plates and they are answer for it, if let's say a patient is actually having defect, right? So they will give an answer differently and the answer is actually made as such. That means if let's say that patient has to make mistake, if let's say they have red green defect, they have to make mistake at this particular plate and they have to actually tell the number in a fixed one. Okay, so it is actually made such way. Okay, it is not based on the number of mistake the patient make. Okay, it is about that they make the mistake at the correct plate that they're supposed to make a mistake. Okay, so it is designed such way. So that is one thing that you have to understand when it comes to Ishihara plate. So it is not simply by recording down the number of mistakes that patients mentioned or patient made, but it is actually checking whether they make the mistake at the right plate or not. So it doesn't matter whether it's for 14, 24, 38, the mistake is already mentioned here, which plate that the patient should be making mistakes. Okay, so that is Ishihara plates. Okay, so analysis. Okay, if let's say you are, going for screening or you cannot do the recording one by one. Obviously, you can't do the recording one by one. So there is a shorter way of recording it that is recommended by the creator of this Ishihara plate. So a person who is normal, they should actually make more than 17 over 38. If let's say 24 plates, they have to make correct. They have to get score of 13 over 24 or more, and for 14 plates, 10 over 14. Okay, so they can only make about 4 mistakes only. If let's say for 38 plate is lesser than 13, okay, or for 28 plates lesser than 9 or lesser than 7 for 14 plates, then that means they have some deficiencies where the patient has to be checked at which plate that they make mistake. Okay, so if let's say the patient is having some abnormality, okay, the plate number 18, 19, 20 and 21 is the crucial plate that you have to focus on. If let's say the patient is actually made a mistake and they read it as 5 to 45 and 73, something is not right. So they have red green deficiency. While for 24 plates, if let's say they make mistake on plate 14 and 15, they mention it as 5 and 45, then something is not right. So they might have red green defect. Red green defect. For 14 plates, plate number 9, if let's say they read as number 2, not the correct one, then patient might have red green defect. Okay, so this is this score is for screening purpose. Okay, if let's say the patient is, coming with no complaint, okay, you just, check the score should be enough. But you have to pay attention to this plate 18, 19, 20, 21, plate number 14 and 15, and plate 9 accordingly, respectively to the number, the Ishihara type that you are using. Okay. Okay, how to take care of this Ishihara plates? Okay, first of all, the book test should be kept close to avoid fading of the color. Number one rule when it comes to any color vision test. Okay, doesn't matter Ishihara, D15, or any other color vision test that I'm going to actually explain in a while. One thing that you have to do is you cannot expose the plates. Okay, even in Ishihara, the dots, right, the one with colors, you cannot touch them. Okay, nobody can touch them. Then you can question me, how do we actually trace that? Trace on the air. Okay, not by touching the plate. When you touch, it get contaminated. The color will get contaminated. That's why it will get fade faster, or the color won't be sensitive optimally, for you to detect any color vision deficiency. That is number one rule. Cannot touch the plate. Number two, okay, you cannot expose the plate to a bright light. So if you are not using the Ishihara plates, keep it closed. Don't let the book to be open and exposed to any lights, or even air also can actually contaminate the colors. So second is avoid. Please keep the book closed all the time. Doesn't matter any color vision book, it has to be kept closed. Third is not exposed to direct light. Okay, so that also will damage the colors. So these are the three things that you have to do to any color vision test that you have. That is the Ishihara plates. Now we move on to the pseudo isochromatic plates, part 1 and part 2. Okay, so pseudo isochromatic plates, this is pseudo isochromatic, not this one, yeah, sorry, yeah, this is a mistake. So this is the pseudo isochromatic plates. Okay, and they have two versions, part 1 and part 2. So it is also known to be SPP1 and SPP2. That is a short name of the pseudo isochromatic. So SPP1, it's screening test for congenital red-green deficiencies. Okay, Ishihara is for red-green also. SPP1 is for red-green. SPP2 is for acquired color vision deficiency, which is blue-yellow, and also for RG. So like SPP2 is more a complex version of the color vision test that we have in the booklet form. Okay, so this test figure, okay, they have test figure. Okay, so vanishing to be seen by normal and be missed by abnormal. So they have like vanishing plate over that. Okay, so this will only be identified by patient who is normal. If not normal, then they won't be able to see. So SPP1 contains of one vanishing test figure, while SPP2 have 2 or 1, depends, okay, of vanishing plate. Okay, and then we also have the hidden one. So to be seen by abnormal and missed by normal. So this one is the vice versa. If let's say you have color vision deficiency, then you will be able to see this plate. If you have color vision, normal color vision, you won't be able to see this. Okay, so what is the purpose of the hidden test figure is to detect mild defect or reduce the anxiety of the those who are having color vision deficiency. If let's say they see the first plate, I mean see the vanishing one, they cannot see, they get anxious because they cannot see anything. So to avoid that, we have this hidden test figure. Next one is the comparison. Okay, state which of the two test figures on each plate is more visible. Okay, so there are two test figures, and then you have the patient has to tell you which one is more visible. So the purpose of this comparison is to detect mild defect. Okay, sometimes they have it, sometimes they only have one of it. So this is SPP1 and SPP2. Okay, now we move on to the procedure. Okay, this test you can hold it at 40 to 50 centimeter. Okay, so it is tested at 40 to 50 centimeter from the eyes. Okay, normal lighting like Ishihara plates, not directing to the chart or very close to the patient's face. It has to be on the ceiling. Okay, inform patient that any given plate may contain no numbers, one number or two numbers. So you just give them the options. Just let me know how many numbers that you can see. No numbers, one number or two numbers. SPP1 is performed binocularly as it detects only red-green defect, while SPP2, it is monocularly because it can detect the the blue-yellow defect, so the acquired one. Okay, this is HRR plate. Okay, this is the one that mistakenly put in the SPP2 picture, yeah? Okay, so this is HRR, another plate that is used to, detect color vision anomaly. Okay, now we look at the rule first. First, keep the book closed. Do not touch fingers. Turn page by tabs. Okay, they have tabs that is provided. You can see the tabs here. Okay, so you flip the card using this assistance of the tab. Okay, the procedure is again, this is measured as 75 centimeter. Okay, Ishihara 75, SPP2 40 to 50 centimeter. HRR is 75 centimeter. Okay, perform test on the rack of the illuminator. Okay, if you come to our clinic, I will show you during the lab session that in the further investigative room we have like one box in the room. Okay, I don't know whether you have entered the room where we have this Jerem screen, yeah, and also the FSCT and also Paley-Robson chart. If you see, there is one box, on a table. It is placed on the table. That is a rack of illuminator. Okay, the standard light for color vision testing. Okay, so it is tested monocularly. Okay, and it has to have a standard lighting, and we do have the standard lighting in the box, and you have to perform the test in that box. Okay, then only you will be able to get accurate findings. Otherwise, it will be not accurate and consistent. Okay, so they have like a series of plates that need to be introduced to the patient, and the recording is actually slightly different. How? Okay, first it starts with some demonstration first, because we want to make the patient understand what is actually, the task is actually conducted. So the demonstration plates, which is from page 1 to 14, are not scored. Okay, we have to show these 4 plates in sequence, saying, I'm going to show you, when you give instruction to the patient, I'm going to show you some colored symbols. Without touching them, how many do you see? What are they? So this is the instruction that you have to give, because in the plate they are like this. Okay, they have circle, triangle, X, and a blank. So they have to tell us, okay, how many they are seeing first. Okay, is it 4, 3, 2, 1? And if let's say they say 2, okay, what are they? Is it like an X? Is it a cross? X? Is it an X? Is it a triangle? Is it a, empty? So anything. Okay, they have to tell you. Okay, and it comes in a different color. Unless the patient is malingering or totally color deficient, 2 colored symbols should be seen on each of the first 2 demonstration plates, which is the OX and X triangle. Okay, 1 colored symbol 0 on the third one, and no colored symbol on the fourth one. This is the answer that you're supposed to get. You don't need to memorize this. Okay, when we do the hands-on during the lab session, you can always refer to the lecture note to actually, look back on how to perform this task. Okay. So what you have to tell the patient is that these symbols will appear in any of the 4 corners of the page. Okay, it can be, top to bottom to, okay, all the pages will have 4. They just need to tell you how many that they're able to see and what are the symbols. After naming the symbol, ask the patient to trace it with the pointer or brush. Okay, if let's say there is no pointer or brush, they just can scan it on the app. Then say the test itself is made up just these 3 symbols with 1, 2, 1 or none on a page. Some of them will be harder for you to see, as they may maybe less strong in color. So you have to keep reminding the patient, okay, that if it's okay to not see any colors. Okay. So once we are done with the demonstration, where they get the idea, okay, what they have to tell, how many, basically how many, what are the shapes, okay, and then you have to record them. Once they already understand and you also already, ready, then you begin the testing with the screening plates, which will be from 5 to 10. So turn to plate 5 and ask how many color symbols do you see? What are they? Where are they? Similar questions to the demonstration task also. So it is important to obtain an immediate response as to the other number of symbol seen. So you have to get an immediate response. So if let's say patient is actually lagging it to give answer, then it should be something is not right with the eye. No revision of the patient's opinion on this point is allowed. Okay, if let's say patient says red, and then after a while they want to change the answer, no, record the first one. So what is the thing that they immediately can see is the one matter for us. Record the patient response using either X or O in the box provided. Okay, if the patient's reply to all three questions is correct, then place a tick mark. Okay, beside the box to indicate correct response. If, on the other hand, the patient makes an error in answering any of these three questions, no tick mark is actually made. So this is how we are supposed to do. So once the screening is started, same instruction is given. Ask patient to quickly give the answer. Okay, how many, what are they, where are they, and all that. If let's say patient able to answer, then give a tick. Okay, if let's say patient not able to answer, just give X or 0. Okay. Okay, proceed in a similar fashion with plates 6 to 10, turning the page at about 3 seconds interval, asking the patient to answer the same 3 questions as each page is turned. Okay, so you have to be very quick in doing this. So you have to ask patient, okay, when you flip, if let's say, when you flip the page, right, if let's say patient has no problem, no issue at all, then you can actually, just proceed it, quickly to settle that. If let's say the patient is actually struggling, then you should know that this patient is having some color vision defect. So you have to do patiently on that, but also at the same time, they cannot drag for 5-10 minutes just to answer one click, obviously. Okay. Okay, so this completes once they give 3 seconds to answer. This completes the screening test. If all 6 boxes are checked to show correct responses, the patient has color vision, normal color vision, and no more testing need to be done. Okay, so if let's say plate 5 or 6 are not checked, okay, the patient has defective blue-yellow defect, and also the examine proceed to show plate 21 to 24. So if let's say patient able to answer 6 to 10, then you know the patient is normal. You can just stop. If let's say patient make mistake on plate number 5 and 6, okay, that's when you have to actually move to straight away, skip other tasks and then move to 21 to 24, okay, to detect blue-yellow deficiency. If any of the plates from 7 to 10 are not checked, the patient have defective red-green vision. So it is very easy. So they will make mistake in only about, from 5 to plate number 7, plate number 5 to plate number 10. So if let's say 5 and 6 is not correct, then they are having blue-yellow defect. If let's say they are not having, they didn't give correct answer for 7 to 10, that means the patient is having RG, red-green color vision defect, and they have to actually, proceed to page 11 to 20, okay, to detect. If any plates of both screening groups, okay, 5 to 6, 7 to 10 are not checked, all remaining plates must be given. Okay, so that's how we do this HRR technique. So this is how the recording form looks like. Okay, I will discuss further this during the lab session. Okay, repetition. Okay, in a few cases where the color vision defect is very mild, a patient may fail to see correctly some of the symbols in the screening plates, but see correctly all symbols in the diagnostic plates, which is from 11 to 24. So the screening plate must then be given a second chance with the test book rotated 90 or 180 degree to give the figures different location on the page. So the responses are recorded in the boxes headed repetition. Okay, so it is only for patients who are having a very mild defect, but it doesn't show a proper deficiency in the eye. So this would be very helpful. Okay, how to help them is to rotate the plate, okay, for them to see, from a different location. And also when you want to record down the result, you have to write down as repetition. So how do we interpret this result? Okay, so the interpretation of this result, okay, if let's say a patient is having color vision, normal color vision, okay, a patient who gives correct responses to all screening plates, testing stopped at this time. So we don't continue. Just give me a moment here. A patient who makes one or more errors in the screening plates, but none in the subsequent diagnostic plates, and upon retesting gives correct response to all of the screening plates from 5 to 7. So they are considered normal vision. If let's say no mistake in the screening plates, then normal. If let's say they make 1 or 2 mistakes in the screening plates, but but the subsequent diagnostic plates no changes, then they're considered to be, there's no mistake, then they're considered to be having normal color vision. Okay, now how to find out the defective one. Okay, normal we already know. Defective will be if let's say they have red green. Okay, proton, if the total number of checks in the proton column is greater than deutan column, that means if that is the case or the answer that we got, then the patient is known to be proton. Deutan, if the total number of checks in the deutan column is higher than the proton. So if let's say they're proton, they will have number of checks for proton is higher than deutan. While for deutan, they have to be higher than proton. So unclassified as to the type of red-green deficiency, if the number of checks is the same in the proton and deutan columns, or if errors have been made in only the screening plates. Okay, so if let's say they have proton, deutan, we check at the checks. While unclassified, if let's say they have the number of checks the same, okay, that will be a bit confusing. So we have to proceed that with some other options to perform the diagnostic test. And then if let's say blue, yellow, triton, okay, the patient is considered to be triton if the number of checks in the triton column is greater than the other column. Okay, and then if let's say patient is having tetron, total number of checks in the tetron column is greater than the triton. Okay, unclassified as two type of blue-yellow deficiency, the number of check is the same in the triton and other columns, or if errors have been made only in the screening series. So basically, when a patient is having defect, right, they would actually have more checks, okay, on certain colors. Okay, that would indicate that the patient is having this kind of color vision deficiency. Okay, the same applies for the blue, yellow also. Okay, expensive scattered errors. Okay, expensive scattered errors throughout the various groups of plates may indicate. Okay, if let's say the result doesn't show that, a distinctive way of actually classifying this patient to be proton, deuteron, or triton. Okay, this may indicate that the patient is actually malingering, tipu-tipu, or monochromatism, total color blindness, as we discussed earlier, and low color discrimination approaching monochromatism. So these are the things that, will be, if let's say we have results that is difficult to be concluded. So this could be the reasons. Okay, now we look at the last booklet test, which is the City University test. So this is how the City University test this looks like, and this is the recording form, comes together with the book, and this is how the color vision test looks like. This is the target, the dots that patient has to see. Okay. So it contains 11 plates, including one control. Okay. Each plate consists of one central. Okay, if you see the picture, this one central where, and then they have different colors at the side. And they have to actually circle the color which is actually similar to the center one. So that's how we do it. So each plate consists of one central circle surrounded by 4 other circles where one of it is similar to the central one. And they have different sizes. Plate 1 to 6, the colored circles is about 8 mm in diameter, bigger size. While plate 7 to 10, it is colored circles, 4 mm in diameter. So this that means the behind pages would have like a more complex thing to be tested in a smaller size. And this is how it looks like, the recording form. So what you have to do is when patient fills up, you just need to cross this, which I will explain in detail during the lab. Okay. So that is the last slide for the booklet diagnostic test or booklet screening tool for color vision deficiency. So we looked at Ishihara, and then we looked at HRR, SPP, and also the last one is the City University chart. Okay, so that's all for the video, for this video. I will continue back with the diagnostic tool in the next video recording. Okay, thank you.